Welcome to the second video about anamnesis and medical history taking. Anamnesis is a key skill of medical examination that is essential to figure out what your patient needs and what he or she suffers from. If you haven't watched the last video, I highly recommend you doing that because we will just continue where we stopped last week. The link is in the description down below. As always, this video is for education purposes only and in no way meant as a medical advice. We've been also introducing the mind palace technique in the last video, and we will just continue doing that in this one. After asking about quantified pain, we ask about accompanying symptoms such as vomiting, sweating, fever, dizziness, and so on. Even if the patient has already mentioned some of them before, ask explicitly for them because there might be something in addition he has left out. In general, a real conversation will never go exactly like this, especially not in an emergency situation, but it's up to you to give a clear structure to the conversation. Otherwise, you might end up in a patient telling you an endless story of suffering without providing the information you need to help him or her. And that's what both of you want. The next question is about the medical history and health record of the patient. We don't ask in this concept for anamnesis about medication yet, but of course if the patient says something, we'll note it already down. Asking for the medical history also gives the patient the chance to reactivate many memories of medication he has taken in the past or why he or she is taking them now. We ask explicitly for surgeries, diagnosis, treatments, accidents, hospitalizations, rehab, and noteworthy diseases in the past. Afterward, we come to the review of the systems. This is all about the vegetative, involuntary processes of the body. So we ask about appetite, thirst, bowel movement, micturition, cough, trouble breathing, sleep, and general stress level. Although the two least are a bit controversial at this point, I was taught to do it that way, and there's also some literature suggesting doing it at this point. In general, there's no right or wrong in terms of anamnesis, and everybody does it a bit differently. And it's just important to have a clear structure and to avoid leaving essential questions out. Then we come to allergies. We ask about allergies in general, allergic reactions in the past, and whether the patient has any document that documents his or her allergies, and if he or she has it, whether something is missing to their knowledge. Ask also about food intolerances. Then we come to the medications and drugs. So we ask what prescribed drugs patients take, why, when, what dose, the drug application, route, or how long they've already been taking it, and whether they are aware of any side effects. Ask also for any self-bought drugs or drugs that were not prescribed but are taken anyway. You might need to give the patient some time to clear his or her thoughts if they have a lot of different drugs that they take. Always be empathic and imagining being in their position. They are already suffering. They might be ashamed of their condition, and now, on top of that, they are also supposed to respond in a pharmacological language that is probably not their mother tongue. Usually, there are forms for the patient to fill out beforehand to avoid that you wait for too long. Once you've got that, you can also ask about smoking or drinking habits. Do everything to avoid a judgy sound in your voice. You want to learn about the patient and not to give them a moral lesson. It might be needed to recommend the change of their behavior, but that also needs to happen at eye level. Finally, you also need to ask about the use of recreational drugs. You might want to remind your patient of your professional secrecy if you talk about that subject, and that all the provided information will just be used in order to help them. Then we go to the medical history of the family. It is essential to just collect data from family members that share genes with the patient. There are just a few exceptions. For example, if you suspect an infectious disease or a food intoxication, then you also want to know about the health of the partner or even friends. If applicable, you can ask about previous trips or shared meals at that point. Other exceptions are some psychological disorders, but as I said, we were talking about acute somatic pain. Once you've become clear what relatives' health record actually matters, you can ask about their age, whether they are still alive, and in case they aren't, what they died from, and in case they're still living, what kind of health conditions they are having at the moment. You can start with the grandparents and go from there to the children's or siblings in case they exist. Most people won't remember the medical history of their grandparents, but you can ask about them too. If they've had a rare genetic disorder, the patient might even know about their destiny. You can finish that part of the anamnesis by asking whether there's something health-related else that should be mentioned about the family. In case the health issue is something related to their sexual or intimate life, you would also ask these questions now, once you have already gained a certain level of trust. We won't go into further detail here because most of these questions might already be pretty specialized. General information is the sexual orientation, sexual activity, the usage of contraceptives, and any suffering related to these matters. But you also might leave it out completely if somebody comes due to headaches, as in our example. The patient would be probably also confused about why he or she should talk about sexual habits if they come into your office because of knee pain, for example. Finally, we come to the social part of the anamnesis. Although it has the lowest priority, comparingly, it is still important, especially to get a holistic understanding of the patient and his or her needs. I always start by asking them about their profession. That is an objective question and leads to a lot of related answers. The patient might answer that he can't work anymore, maybe even due to the suffering he's here for. Or he might be retired or not being able to work at all due to a disability. Then you can also ask about the marital status, although you can probably leave that out depending on the age of your patient. You could ask a teenager whether he or she is in a relationship, but that would be in most contexts probably too indiscreet. But if you suspect an HIV infection, it would be appropriate. Make always the reasoning, especially for intimate questions, clear. If you haven't already asked about previous trips, then that's the time for that. Finally, you might also want to ask about hobbies, religious background, especially if you have somebody in front of you where religion seems to be an important part of their life. If applicable, you can also ask about social, cultural, or national background. All of that is meant to facilitate a holistic understanding of the patient. A refugee from a country that has malaria cases might need some more tests to rule Plasmodium infection out. Somebody who's used to another healthcare system might need an additional explanation of the protocols in your country. Make sure you never give the impression that you take somebody less seriously because he or she is from a different cultural background, but also don't ignore these differences if you have the feeling that they could become a threshold if not addressed. So show respect and tolerance for every background your patients may have. And at that point, you're done with the classical analysis and medical history taking. Of course, if the patient mentions something you consider being of interest, ask further questions. If you ask in a certain profession or for a particular symptom, then you also need to ask these applicable questions. But in general, you could start now with the physical examination of the patient. Once you've built up your memory palace, you can practice easily by walking through all the hooks. You will notice your growing capability to recall every item in the right order pretty soon. Thank you for watching. As always, you'll find the Notion page for active recall in the description down below. Have a great learning experience and thank you.